Cool. Good morning, everyone. And thank you for joining us for the Energize Colorado Mental Health and Wellness Kickoff event. And before we get going, I wanted to thank all of the volunteers as well as our panelists for joining today. And before we dive into the panel and share more about the resources that we're offering for mental health and wellness through Energize Colorado, I just wanted to pause and address something that I'm sure is top of mind for everyone right now. The horribly tragic events over the past few weeks that have highlighted the degree to which continued racial inequality, injustice, and racism persist in America. The guiding goal and principle of Energize Colorado is to help support Coloradans and their businesses during COVID, as well as through our recovery. And we originally identified a set of segments to focus on initiatives to do this. And while women and minority-led businesses are one of those segments, addressing racial inequality was not a primary focus. But it's now clear to us as leaders, and most importantly as humans, that if we don't make addressing racial inequality as a focus, we're not going to succeed in achieving our goals that we set out to with Energize from the start. And so, I personally don't have the answers, and I know that Energize Colorado doesn't have the answers right now, but before we dive into this, I want to share that we're all committed to listening and learning about how we can address the inequality and injustices through the work we're doing so we can all succeed and thrive as part of this recovery. So now I'd like to introduce Brad Feld to talk more about the Energize Colorado mission and why mental health is a key initiative for us. And it's just as important now as it ever was in helping everyone through this recovery. Thanks, Brad, for joining us.
Thanks for having me, and for those attending, thanks for being here. When the COVID crisis started visibly in Colorado, which was the week of March 11th, a number of people in the business community engaged very, very quickly. It was some in the entrepreneurial community, but more broadly in the business community across the state. And at the end of the month, I wrote a post that I called the 3 Crises. And looking back on it, it has played out in some ways similar to how I conceptualized it in that moment. And what I'd conceptualized with the 3 crises was that the COVID crisis itself wasn't simply a single crisis. It was actually the intermingling of and the interdependency of 3 separate crises. The first was a health crisis, which today I think is a well understood dynamic that we're dealing with. The second was an economic crisis, which was triggered by the health crisis. In the absence of the disease of COVID, our economy was in general very strong in many parts of the world, and certainly in Colorado. We had plenty of inequities, but at the same time, broadly speaking, we wouldn't be having an economic crisis, most likely, in the absence of the health crisis. The third crisis is a mental health crisis. And my view was that we would have a mental health crisis across society as a function of the linkage between the health crisis and the economic crisis. And specifically, simple things like the idea that we'd be locked in our houses for 24 hours a day, 7 days a week with our families. The fact that we'd have complete and total disruption of our normal social patterns, our normal work patterns, the economic stresses that people would have, the work stresses that people would have trying to balance work while being at home and in a home environment while trying to get their work done, while also then trying to deal with everything else. Like those, the interdependencies of those, independent of all the second order effects that would occur, would be profound. Now, it's important to make the comment that these individual crises are not new things that appeared out of nowhere. They're things that ebb and flow and become front of mind at different points in time. We've had multiple economic crises. We've had many other health crises, both in the United States and around the world. And in Colorado, we've had mental health as an issue, especially around business and entrepreneurship. And the crisis around mental health has become much more visible in the last 4 or 5 years. And so it's not that we suddenly have a new phenomena, but that we have intensity around these existing phenomena that have been going on for a long time. And this incredible intensity around the health part of it has then triggered focus on and interdependency with these other crises. And I want to come back to that in a second. In the context of Energize Colorado, relatively early on, it was I think March 23rd is the date that we describe as a founding date. A number of us that were already getting involved in different activities around business in Colorado started to really focus on businesses under 500 people. So I personally don't like the label small business. I think it is not a particularly expressive or inclusive label. It means different things to different people, and it tends to be very challenging to use it to cast a broad net. And so we started talking about helping companies under 500 employees or less, all the way down to individual entrepreneurs, people who had sole proprietorships and were the single employee, even the contingent workforce, so people that had part-time jobs, but were self-employed in that regard. And as part of that, we decided to put together a new organization, which is Energize Colorado, to have Coloradans help Coloradans. And many of the early leaders of Energize Colorado are owners, managers, leaders of businesses with less than 500 people, or investors in those types of companies, or people who participate actively in those types of businesses, or who have affinity across the state for those types of companies. And as part of the launch, we set out a series of different initiatives to try to address all of these crises. And obviously the economic crisis would be one that people would think of as the focal point. But at the very beginning, our view was we had to embrace and encompass this notion of the mental health crisis and recognize that the mental health crisis was a key part of the health and recovery and growth long-term of Colorado, and of Colorado, not just people and citizens, but also businesses, not just the owners of those businesses, but the employees of those businesses. And then understanding and doing what we could as an organization to help address these issues, provide a forum for discussion, provide resources for business owners, as well as for employees, as well as for people who are affiliated with the business, whether it's spouse or children, to try to make sure that we're addressing what we believe is a very key part of the crisis that has been triggered by the COVID crisis. And remember, I just want to come back to this as I finish the thoughts. These are not new phenomena or new crises, but it's an intensity in this moment of the intersection of all of them that really are motivating many of us to help each other. I love the tagline of Energize Colorado that's emerged, which is Coloradans helping Coloradans, and really focusing on those of us in Colorado, in the private sector, working in conjunction with the public sector, in conjunction with philanthropic efforts, to really help each other in this moment of crisis. I want to just end with a comment that links back to Chris's remarks. I think many of us are hopefully thinking about struggling with trying to be productively engaged with the fourth crisis, which has appeared, which is a racial inequity crisis. And there's multiple different labels for it. But I think the idea of calling it a racial inequity crisis is an easy way to focus the energy on the conversation. You know, the last week to 10 days in our country, from my perspective, has not been a particularly proud one. It has put emphasis on a crisis that is, again, not a new crisis. Systemic racism in our country is a problem that has been going on for a very long time. It is something that we, different parts of our society, address for periods of time and then don't put nearly enough focus on for different points in time. And in this moment, when I struggled through the weekend, when I woke up Monday morning, I was comfortable with the idea that we really had a conflation now of 4 crises, all critical, all independent of each other, but also all interdependent of each other. And while there's many things being said and done already, I think a long arc of how we approach things from a Coloradan perspective and with Energize Colorado is to make sure that we're really conscious of the 4th crisis that we have here and of our responsibility and ability to do what we can to address it as an organization. I think Chris said it really well. And my perspective frankly, as a middle-aged white guy, is it's really important for me to be an ally and to listen and to understand what I can do to be helpful in a moment like this and to actively engage. And I would put the same sort of articulation around ally on the other elements of the crises that we're talking about as well, not to minimize any of them, but to recognize that even if you personally haven't struggled with mental health issues, being an ally in that context is very powerful. Even if you haven't struggled with racial injustice personally, being an ally is incredibly helpful in that context. Many other things can come from that, but I think it's just worth sort of acknowledging that we're in this moment of incredible challenge as humans and as a society. And one of the things that I'm most proud of being a Coloradan is that my lived experience in Colorado is that we work hard to help each other, and it's a value of ours. And hopefully we'll be able to continue to do that. And today's conversation about mental health and wellness is just another component of the various things that we can do there.
Great. Thanks, Brad, for adding that and reminding us, of the greater things we're working towards and how, taking care of our mental health, fits into all the crises that we're going through. Before we jump into the panel today, I wanted to just share quickly with everyone some of the resources and initiatives from a mental health perspective that we've been working on. And we've really focused our efforts along 2 dimensions: one, aggregating and providing great resources that people can use on their own, as well as actually direct access to mental health professionals within our community. So first, on Energize Colorado, the website that we're supporting, the team has pulled together an amazing collection of resources and partnerships and content that everyone in the state can access on their own to help with various aspects of the mental health crisis and help them through this, including, some special partnerships and a special offer from Simple Habit that's given free access to everyone in Colorado to their meditation app through this. So I'd encourage you guys to go check out the site and see what resources are there for everyone there. Second, and this is the effort that I'm most proud of what the team has done, is that we realize that resources and people getting help on their own might not be enough right now. And so we've actually worked with a bunch of organizations across the state, including Sondermind, Mental Health Partners of Boulder and Jefferson County, CU and DU, to pull together a bunch of free therapy sessions for those in need that have lost their job or been financially impacted as a result of COVID. So I'd encourage you to check out the website and find access to those resources that would be best for you as part of this, because, as Brad said, we're all here to help each other with this, and these resources can be a way to help all of us through this. So with that, we'd love to turn over the conversation, the panel, to Dr. Terry Finney, who is going to introduce the panel and the panelists today. And the focus is really on helping us all understand that what we're going through right now, as Brad highlighted, is something that we're all in this together, and we're all experiencing a bunch of challenges together, and to talk through that. So I'd love to introduce Dr. Terry Finney, and welcome, and thank you for joining us.
Thanks, Chris. First, I would like to introduce our panel, to whom we are very grateful for today. We have Brad. Obviously, we've met Brad. We're grateful that he's been a long-term advocate for mental health in the entrepreneurial community. We have Maggie Hanna. So Maggie is, and she has kind of a long title here. Maggie is the where'd she go? The Director of External Relations for the Cattlemen's Agricultural Land Trust. Did I get that right, Maggie? Okay. So she is from a multi-generational ranching community. So she's deeply ingrained in the ranching and farming community, and she's been an outspoken advocate for that community, communicating more openly about mental health issues. We have Elijah Wilkinson. So Elijah is an offensive tackle for the Denver Broncos. He is also an owner of a small business. So we're happy to have him here today. We're grateful for his enthusiasm, for his ability to talk about and put emphasis on open communication, for his concepts about mental healthness, and also thank you, Elijah, for the hopefulness that you're going to offer to us. And we have Jeannie Ritter. We don't have Jeannie's picture, but if we did, she's lovely. Jeannie is former First Lady of Colorado. She is a Vice President and Mental Ambassador for the Mental Health Center of Denver. So she's been a major advocate of mental health, and she's traveled all over the state of Colorado in terms of understanding and promoting mental health. So Jeannie has a kind of a breadth of experience that we're going to appreciate. Jeannie, are you here? She will be. I have faith. So while we all know that that we're impacted by the COVID-19 crisis, we're affected differently. People experience things differently. Some people are experiencing this kind of mildly as mild discomfort. Some people are experiencing it more in a way that's impacting their functioning, like their physical functioning or their work performance or their parenting ability. And some people are actually experiencing crisis, and the kind of crisis that would lead to suicidal thinking or behavior. So as we go forward and talk about this with our panel, I want you all to feel free to comment on, you and your community's experience. And also there are some people who aren't experiencing mental health issues from this or discomfort, and feel free to talk about that as well. So the first question, I'm just going to start with you, Elijah, because you've been more impacted by this directly, by the events of the last 10 days, the George Floyd fallout. So you have more heightened awareness of racial inequity. And you're also a business owner, and you've had to deal with COVID-19 and how that's affected your business. So if you would, could you talk about how you and your community have experienced all of this?
More specifically, what do you mean?
So you and I talked about before this, you and I had a conversation about specifically in terms of the George Floyd fallout, about your hopefulness, and that your hopefulness is based on communication, and that the communication has come a long ways over the years. And you also talked about, and I was really impressed how you talked about in your community, one of the things that's been really helpful, and in your business community, your personal community, is to talk, and to stay communicating with each other. So those are the things probably specifically that I think we'd love to hear from you.
Okay, thank you. Yeah, I think, this is definitely, these are tragic times that we are in, definitely the death of George Floyd, and, there's a long list of names, Trayvon Martin, you can go on for days. But the thing I was talking about with hopefulness and, kind of having hope that us as a nation are, going to experience some kind of change of some sort is there. But the thing is, it's not going to, it's not going to get there without everybody, white, black, or indifferent, speaking up and speaking out. And I think that we've seen, and I've seen, from being in Denver in the past few days and week, there's more, and not more, but, a lot of white people actually protesting, down in Denver, about, the cause and about, what they believe in. And I think that, that is a step in the right direction, trying to, bring justice to the situation, number one, but also number two, changing, you know, the outlook that everybody has on, you know, the Black race in general. Secondly, on everybody talking about it more, talk. I think that, you know, it's something that we're going to have to continue to do. And, you know, it's not, we can't spend countless time on it because we go all day, especially, you know, as me, you know, with the Broncos as an organization, or, you know, with peers, or however it may be. Everybody, you know, if opinions have to be voiced, you know, people have to keep people kind of in line with, you know, how they're speaking about in another race. And it doesn't matter, Indian, Black, white, it doesn't matter. So everybody has to like keep that code of basically, you know, what, you know, how to treat somebody, you know, and how to be able to let people know that they're equal, and, you know, just be fair to everyone.
It's really helpful. You also talked about, and I think we might be curious to hear, you talked a bit about mental toughness. And I wanted you, if you wouldn't mind, talk a little bit about what that's like for you. I mean, all of these issues, and I know you've been coming back from a physical injury. So talk to us a bit about mental toughness, what that means to you.
Definitely the game of football, you know, you need to have, you know, a certain type of mental toughness to be able to play the game, to be able to go through all the practices, to be able to endure, you know, the pain that we put our bodies through. Outside of the game, you need to have mental toughness, although in the workforce, you know, owning a business, you need to be mentally tough. I've been stressed, you know, to kingdom come, but that can't deter what I'm doing with rehab. That can't deter what I'm doing with you guys on the panel. That can't deter what I'm trying to do in life, other than the barbershop, other than going to work, or other than rehabbing. It can't deter that. So the mental toughness aspect, you know, it's not only for the field, it's for, you know, life too, you know. So I think that, you know, that could be applied in both situations.
Yeah, and you have a real commitment to that. It's obvious. Maggie, what about you? You come from a farming and ranching community. How have you experienced this, and how has your community experienced this?
So I just want to share that I represent parts of the farming and ranching community. I think they're through the entire pandemic process, broader populations have been able to see the food supply chain and how many aspects there are to it. So I am at the very early end of the supply chain here in rural El Paso County. And one of the things that struck me early on was that the isolation component that a lot of communities were dealing with around the pandemic was less impactful to the communities that I come from, because we exist in a somewhat isolated life. And I think so the real challenges started to come when we began to understand the unraveling of our supply chain and the unraveling of our financial components to the supply chain and to our product. I think for many years, the agricultural communities have been challenged by financial and economic crisis to some degree. We ebb and flow through drought conditions and flood and fire. And for the last 40 years, our commodities have basically been the same price. So the generation ahead of me made the same amount of money for a crop that my generation is making today in 2020. And our input prices and costs continue to climb. So those are the challenges that I am most worried about in my community. And I think the other component that I think has been brought to light by current crises is our inability to access specific care or health or resources. One of the things I'm most excited about coming through the pandemic and economic crisis is that we've been forced into technology. And so we now have to access things electronically. And if accessing health can happen in the privacy of our own homes, the chances that a rural community member would take advantage of that increase dramatically. I know that there are barriers to access from a cultural component and a financial component and a physical access component in our communities. Many of our counties in Colorado don't even have a healthcare provider that could provide mental health. We lack access to hospital care in many places. And so if we can touch the mental health community and say, this is something that can happen in our own homes, in the privacy of our own homes, and address it on a personal level and not have to bear the weight of community input. I think those are some like powerful things that our community will be able to take from this. But to your question about how the pandemic has impacted rural environments, I can't speak for everyone, but the 5 ranches that I am surrounded by, I don't think have carried the isolation component as much as the financial component.
So Maggie, would you also speak to, we know that statistically farmers and ranchers, probably absolutely the highest leading cause of suicide from external forces, the highest, I do know words here. Suicides are at a high rate for farmers and ranchers, and there are reasons, specific reasons for that. Would you mind speaking to that?
Yeah, and I will just share, I know that this is part of my bio wherever you turn, but I am the child of suicide. My dad took his life when I was a little girl. So that's how I found my path into mental health. I think the agricultural communities struggle with suicide for a variety of reasons. One, we have access to lethal means that is relatively convenient. We have a mentality of, we have to be able to fix these things ourselves. If you have a flat tire and you're 50 miles down a dirt road, you have to be able to get out of that situation by yourself. And so why we apply that to our own physical and mental well-being is somewhat natural. I think the other concerning component, in my opinion, is that for generations, we've taught ag producers that to be able to make it in a margin industry, we have to trim the fat or trim the weakest link. And oftentimes when we get into a mental space of seeing ourselves as the weakest link, we see that that is the option to eliminate when things are not going well, when we're not financially healthy, when we're not physically healthy. I also think that for rural communities and ag communities, these are somewhat dangerous jobs. And so physical injury results in a huge mental burden for a family, for a community. And so chronic pain, I think, leads a lot of our farming and ranching community into the sort of dark portions of mental health. And I think one of the things that I'm hopeful for around rural and agricultural communities is that we really do pride ourselves on taking care of each other. We still stop on the side of the road if someone's broken down. We still get all of our ranch work done through neighboring. So my neighbors come and help me. I go and help my neighbors. I'll brand tomorrow with some neighbors. And if we can apply that to our mental well-being and check in on one another, I actually do think there is an accountability built into these communities that we have to be able to access and apply to more than one aspect of our lives. So I am hopeful that we can take care of each other like we take care of our herds, our crops, our schools, our fire departments, things like that.
Thanks, Maggie. We absolutely need to get better at taking care of our herds. Jeannie, welcome. We're glad to see you in person. Oh, we can't hear you.
There we go. Happy to join you. And I really want to acknowledge both Elijah and Maggie doing such a great job of connecting physical health and mental health. I think that was a great way to tee this broader conversation off, because the two are so linked, and you both did such a beautiful job of making that connection for us. Hi, Terry.
Hi, Jeannie, do you want to talk about what you've seen, kind of broad picture, because you have more of a broad picture about how both of these issues, excuse me, the pandemic issue and the racial issues that have been so ugly lately. What are you seeing?
Well, at this time, you know, I work in the city and county of Denver with the Mental Health Center of Denver. And while I'm not a provider, I advocate in the community and work on partnerships. And so I see lots of linkages there. But as you stated, I had a great opportunity. It's been some years now since we left office in 2011, but to travel the state. And both your panelists before me articulated just the resiliency and even the kind of nimbleness that that folks out here have in the West and in Colorado. And that's, you know, you and I touched on this, Terry. It was a much quieter conversation back there in 2007, 8, 9. I was having conversations in church basements, right? Where folks weren't really ready to kind of open up about this. And so I really celebrate kind of the level of literacy and comfort that people, such as these folks on the panel, have really helped to advocate for. And it's caught on. In reflecting on this panel today, I had to go back to, you know, it's great. Some of us have developed a comfort level around this topic, but there are folks also that that don't have that, and it's harder. And Maggie, you know, what a great job talking about our rural communities. And I remember that many years ago, right, over 10 years ago, there was a fellow who was a rancher who was so great in Southeast Colorado about letting us use his image, right? Jean jacket, cowboy hat, leaning on a fence post to really promote accessing services and getting supports. And I was so struck by the community saying, folks would sometimes, men would sometimes come in with that little poster that maybe they swiped from the front window of maybe a store or a bar, or, you know, and they would just roll it up, tuck it in their pocket. And when they came for services, they actually couldn't say anything, but they would unroll that little image of that rancher to just demonstrate like where they were in their path. And so it is, you know, it is a time when, as Elijah said, you know, everybody's got different strengths here, and how we bring our strengths to this, and how we recognize maybe that's not a strength I have, and who can I lean on to kind of help me advocate or do the piece I want to do to contribute. So I hope that, you know, I hope that's an illustration of broader Colorado.
Thank you for that. Brad, what are you experiencing and or observing or feeling in your community, which is primarily business people, startups?
One of the, I'll tag on to something Jeannie just said, which is in entrepreneurship, for a long time, there was a very significant stigma associated with mental health, and acknowledging that you had any issues around mental health. And the word stigma is the right word. When I was in my mid-20s, I had a multi-year depressive episode, and I was incredibly ashamed. I was ashamed about, I was CEO of a company, being exposed as somebody who was struggling. I was ashamed about ultimately getting therapy. I was ashamed about taking medication. And that shame was directly linked to the stigma that existed around any issues of mental health. In 2013, I had another depressive episode. I had several along the way, but I had another major depressive episode that lasted for 6 months. And this time I was very open about what I was struggling with for a variety of reasons, including that several entrepreneurs in the previous year had committed suicide. And while there was a little bit of a conversation starting, it wasn't very much of a conversation. And it certainly wasn't around the stigma. It was mostly around things like, oh, I was with, person X last week and it seemed like they were doing fine. And, how could this happen? Person X has, or person Y has, all kinds of resources. So it wasn't really the conversation the next level down. It was just sort of the surface level dynamic. And in 2020, I think among entrepreneurs, while there is still stigma associated with mental health in general in our society, and it is still something that's very difficult for many people to talk about, to address. It's very uncomfortable. And for one, when they're struggling with whatever kind of mental health disorder they're dealing with, whether it's some form of an anxiety disorder or something that's beyond just, oh, I feel stressed or I feel under a lot of pressure, but clinical obsessive compulsive disorder or bipolar disorder or borderline personality disorder or clinical depression, like the ability to be self-acknowledging, to be able to be comfortable talking about it, to be able to go recognize the value of getting help and getting help. There's still a stigma, but the stigma is less. And it's less because people talk about it, people acknowledge the dynamics. There are different levels of resources available, and the power dynamic, especially in business, of being a CEO versus being an employee versus being somebody that has clients or investors, and trying to understand sort of where you are in that power dynamic and whether or not you can be open and who you can be open to is part of that reinforcement loop around the stigma. An example would be if someone's a CEO of a company and they're feeling incredibly anxious and they're not sure why, or they think they might be depressed, or somebody has observed that their behavior is erratic or unpredictable, that could be somehow linked to mania, or pick a different disease. Can you talk to your board about that? Can you talk to your investors about that? What are the risks? What are the risks if you're publicly known to have struggled with these? And I think a number of entrepreneurs have been really powerful role models of successful business people who have struggled, who have acknowledged their struggles, who have gone and gotten help, and who continue to support and advocate resources for others, whether those resources are clinical, therapeutic resources, whether it's coaching, whether it's peer groups, whether it's having just resources available, even one-on-one, to talk to, and being essentially as a peer empathetic to your other peers and being available to them. So there's a lot of different kinds of things that are happening, but I think in this particular moment, something I'm very pleased about when I reflect on it is it has not been at all uncomfortable for people to name that mental health is a part of this crisis that's going on. Doing something about it, and I think Maggie described it well, doing something about it and actually taking it on yourself to address your own dynamics in the moment is a different issue. That's hard. And it's hard for everybody, including people who are generally pretty good at addressing it. Other priorities, you have imposter syndrome, survivor guilt, fear of bringing attention to yourself. Oh, I don't have it so bad. I've got resources. Look at that person over here who doesn't have resources. Why should I be complaining about this? And then of course the negative loop that happens, especially when guilt gets into the mix, which is, let's say you're a business leader and your business is doing pretty well, but you're struggling personally. You're exhausted, you're worn out, you're under a lot of stress, your family is struggling, one of your kids is really having a difficult time, you haven't had any time for yourself in the last 2 months, You have an aging parent who is behaving in a way that makes you uncomfortable because they're not taking care of themselves or being safe, but they live far away and you can't do anything about it. And you look at it and you're like, yeah, but my business is doing okay. Why should I be feeling any of these things? And like, just step one of acknowledging this is really fucking hard for everyone. And regardless of how you actually deal with it, step one is just acknowledging that it's hard on you also. And there's a good metaphor from sports that's useful here, which is if you don't take care of yourself while you're training, you can't run the race. And if you're an athlete and you train day in and day out, and my guess is Elijah, I'm a marathon runner, but my guess is Elijah understands this much better than I do. Even if every day you increase the intensity of your training and you never recover, you never take a rest day, and you never do things to actually let your body recover, you will just break. And if every day is more intense than the previous, you will just break. And one of the really important things around the issue of mental health, especially in a crisis, is to allow yourself to have the space to recover, to be able to take a break from all the things that are going on, especially if your personality is one to help others and you're trying to help others. Or even if your personality is one where you're very inwardly focused on your own stuff, but you're focused on your stuff, not yourself. And just recognizing that you as an individual, you as a human, need that rest and recovery and that space and time to be able to recover and maintain intensity against all the things that you're trying to go after.
We appreciate that. And, my experience being a fifth generation Colorado and working with people for 30 years, and especially working with entrepreneurs, and Maggie touched on this too, is that we are a very independent group of folks. I mean, people who come to Colorado are people who are pretty independent, and they're pretty much rough and tough and hard to bluff, which makes it really difficult to ask for help in my experience. And I think that that's the stigma that one of the stigmas that Brad was talking about with entrepreneurs. I'm curious, and feel free to jump in terms of like action items. How are you all dealing, and what would you recommend to other people? Like, what's an action item in your life and that you would recommend for coping?
I'm happy to start and reel off a handful. I try to take what I call a digital Sabbath every Saturday. It's not religious, from Friday night, but Sabbath is a good metaphor for it. From Friday night to Sunday morning, no phone, no email, no structured work-related meetings. It doesn't mean I don't interact with people over the weekend. It doesn't mean that I don't do things over the weekend, but I don't check my email. I try really hard to give myself time and space, time with Amy. So the equivalent of time with my family from the, previous rest of the week, where lots and lots of other people, I'm spending my time with them or committing my time to other things. And during that, I give myself luxuries that I like. One of my favorite things to do in the world is lay on the couch and read a book while Amy's reading a book. Another one of my favorite things to do is take a nap in the afternoon. And so just knowing those things that I view as sort of emotionally luxurious and allowing myself to do them and giving myself consistent permission, not, oh my gosh, I need a nap today, but hey, it's Saturday afternoon, time for a nap. So that's an example. Another example is that while we've been living at home, and I was searching for Jared's words. Well, while we've been safer at home now and in the wilderness, I think is what it's called. I don't actually expect that I'll be leaving my house on any regular basis until 2021. For a variety of reasons, including my clinical disorder is obsessive compulsive disorder. So the disease state actually terrifies me and makes me incredibly anxious. And so one way to cope with that is just to say, all right, I'm just going to stay away from the disease state as much and as long as I can. One of the one of the things that Amy and I have done on a daily basis is we spend what we call 4 minutes in the morning. And, whoever's a second of us to get up, we consciously spend a few minutes together. Sometimes it's 2, sometimes it's 7, but it's this idea of just a few minutes together, just sitting and talking and saying good morning. If you've got a family and kids and you're all in the house together like that, just sort of very calm, calibrating moment over a cup of coffee, over breakfast, or just sitting is very grounding for me personally before whatever happens for the day. And then one other tactical thing, sort of in the context of my world, is I try to say to a lot of, I try to use 3 words or 3 phrases all the time that my mother taught me when I was, 5 or 6 years old to always say, which are please, thank you, and you're welcome. And really just acknowledge other people in these moments in whatever it is. It feels like a small thing, but it's kind of like the equivalent of a smile. Like it feels good to me as much as it probably feels good to the other person. And in this kind of an environment where we're connected via computer versus being physically connected with each other, just taking an extra moment of acknowledgement, for me at least, is really helpful. It's not important for me that people say thank you, please, or you're welcome to me, but it's very helpful for me to do that with other people. And so find your own version of that in terms of that human to human connection that reinforces to you that you're connecting with another human being versus just doing another thing as the arc of your days pass.
I was going to ask people where they find their stability, and I think you pretty much answer a lot of those questions. Maggie, Jeannie, and Elijah, what are you doing? What would you recommend? What's your action item for people going forward?
I'll just follow. Brad did such a great job, setting the table for this. But I appreciate folks who are really kind of still isolating and being careful. But I'm thinking, as a nod to smaller communities that are opening up, I just want to acknowledge the value of those small businesses to the health of the community, and that strength of connection that is reinforced by the leadership of small businesses in those communities is really, really vital. And I just and a great example was years ago working, of course we work on college campuses, and young people, faculty, staff, everyone has their struggles, but these unlikely partners in our well-being, right, that we can turn to for our well-being. It wasn't necessarily the college counselor, it wasn't necessarily the systems on the campus. There was a gal who ran a coffee shop off campus, and that's where people went. That was their anchor. That was the place they knew they would be seen and acknowledged. And so while Brad, articulated really well, like this kind of self-care thing, I just want to echo that many people have to go outside for that kind of support. However, the 6 feet thing, whatever we need to do. So that's, I just wanted to kind of give a shout out to just the value of small business like that.
Awesome. Elijah, you want to jump in?
Yeah, if I were going to go, just kind of going off, you were like, you got to kind of take care of yourself at the end of the day, not the stuff you're doing. Kind of, the example of that in my life that I can kind of share with you guys is, it's really busy during, we're on for 6 days out of the 7. So we have one day off. So when we have that one day off, I usually have my little checklist of, massage, chiropractor, have to get done. But when that's done, like, I'm shut down. Like, from there's no football, there's maybe a little Xbox or watch the news or something different other than football for an hour or 2 out of the day, and maybe even take a nap, like Brad had said, or just kind of take care of yourself. I find that super big for me leading into the week, you know, that changes my whole attitude coming in for Tuesday, coming in for Wednesday for practice. Like, you know, I might be sore from the game on Sunday. So like that day, like, and me taking that, you know, whatever it takes, that nap or that massage or whatever it takes for me to get back into, you know, get my fixated on the new week and to get back focused for that week is so for that day, you know. So that's something that, you know, I can attest to, you know, having that, you know, self-care and, you know, taking care of your own mental state and, you know, your body, in my case, your body, and just, you know, resting really, and just taking that time to just like shut things down. I'm always going, especially with the business and, you know, everything like that. So I need that one day for me is like, it's shutting down. And the same thing with the phone on the weekend, you know. With the business, it never stops. Like my phone's always ringing or somebody's calling asking for something. You know, so I kind of, you know, at, you know, 8 o'clock, like, you know, on Friday, like my phone is off, nobody's calling me, you know, that's it. Like it's been, you know, that 5 days, Monday through Friday is already enough. And we're open on Saturday. So, you know, it's still another day that you're going to have to facilitate things and have to, you know, just watch over everything. So it's constant and it never stops. So you have to have that mental break within those things that you're doing in your life.
I will just add that one of the great challenges of addressing mental health in the agricultural community is that the concept of self-care actually does not exist. And this is something that the Department of Agriculture has worked with Colorado Crisis Services on how to talk about self-care, because livestock and crops, they don't take a day off. They don't, our food supply doesn't take a day off. Our grocery stores are still open 7 days a week. And so how we find a balance or a space to have some level of self-care. And I think one of the things that I have really tried to challenge is just giving myself the grace to grind it sometimes and like be on the emotional roller coaster. And it's okay that I'm going to be on this roller coaster and work still continues, or, you know, livestock are still getting moved or put out, or water's getting checked, but I can acknowledge that it's okay that I'm in a different mental space. But I do think that is one of the challenges about talking about stability and mental health for the ag community, is that it doesn't matter if it's Sunday, it doesn't matter if it's Tuesday or Memorial Day. These systems still have some level of demand. And what I think the pandemic really highlighted was how delicate our supply chain was, and that minor disruptions in specific places really has a broad impact on every single person. So I would love advice, if anyone has it, on how to find other spaces for self-care for a community that I think has really struggled to grasp the concept of self-care. But I echo that it's valuable and important and something we should all put value in.
So
Great.
we have tons of resources, and Chris is going to kind of wrap up and talk about that, as well as questions or other.
Yeah, and I'd like to jump in as well. So thank you for all that from everyone. And also actually, Maggie, building off of what you just raised was actually a question we've got that's been asked by people watching the live stream. And we'd love to see if we could get answers to this one question, and then we'll wrap it up because we're getting towards the end of the hour. But the question from the group watching was, knowing that in order to take care of one's health, you need the mental space to do it and the time to do it. And we're all have a lot of competing priorities right now, you know, an hourly job, no PTO, no access to childcare, all of these things that are competing for our time. What can communities or other individuals do to help us get to a place where we can actually create the time and space to have access to seek the care from it? And so if there's any thoughts from the group on that, we'd love to, you know, leave the folks with an answer to that, and then we'll wrap up. But if anyone would like to start there.
I have two quick comments, one specifically to Maggie, and then I think earlier on the question. I think, Maggie, your comment about the emotional roller coaster and letting it be okay to be on the roller coaster is key. When I speak from my own experience, right, I've had long stretches of time where my work was intense and never ending, 100 hours a week, kind of always on every day, no space. And what I have learned is that even though the work cadence is such that that is happening, and I'm sort of having my own ups and downs through those cadences, me being frustrated with myself, me being unhappy with how I'm feeling, me fighting against it, versus, as you said, allowing yourself to just sort of embrace the grind, and allow yourself to feel how you feel. The mistake many people make is they don't actually feel their feelings. And my wife, Amy, is very articulate about this, which she points out to me when she doesn't think I'm feeling my feelings. She actually says something like, feel your feelings. Like, she knows I'm unhappy. She knows I'm hurt. She knows I'm upset. She knows I'm sad. She knows I'm distressed. And yet I'm just, doing my thing. And even in those moments where it's like you pause for 30 seconds or a minute and you're like, you know what? I'm having a shitty day. Or I'm actually really still pissed off at, Mary for the things she said yesterday. Or I'm really afraid of not being able to do whatever next week because I'm not going to have the resources. Like, just even like acknowledging the thoughts and just having them, feeling your feelings, keeping your thoughts, whatever the right phrase is, I think is an important thing. So I just echo what you said and just reinforce it more broadly. On the phenomena of making time and space to be able to help yourself, or self-care, or spend time on yourself, or whatever the language you want to use is, I think that for me at least, I'll just speak from personal experience, in periods where I felt like I had no time, and there have been many of them, what I have often realized is that I'm struggling with what is a very mix of priorities. In other words, maybe I need an hour a week for therapy, but maybe I don't actually need, I don't feel like I have that, but I probably would benefit from 5 minutes of, sitting outside and petting my dog. And the benefit of 5 minutes of sitting outside and petting my dog versus the benefit of, a 50-minute therapy session, who knows? But it's in those moments of not feeling like you have any resource or any space, trying really hard to create really tiny, multiple times a week periods of space, going for a walk around the block with your kid, giving yourself the luxury of sitting in front of the TV and watching a stupid TV show for 30 minutes. If you like ice cream, just, saying, I'm not going to be disciplined today about what I eat. I'm going to have a bowl of ice cream. Those little kinds of things actually add up in a remarkably significant way against the backdrop of feeling incredibly constrained. And the encouragement is to do lots of those little things versus do one bigger thing and then feeling like you can't get to the bigger thing. Hope that helps.
I might just add, and Elijah might be able to add on to this or maybe challenge me on it, but I am excited by my generation's approach to seeing mental health as a wellness instead of an issue. I think my dad's generation saw it as a mental health issue, and my generation has looked at it as a mental health. It's similar to our physical health. We work out and we make a priority for it because we can see a result. It's hard to prioritize mental well-being because we don't necessarily see it physically when we interact with other people. But I do think I am part of a generation that has said, this is worth my time. It is important that I acknowledge that it's part of my wholeness. And so similar to like recovery from a workout or finding space to just grind, I do think we are at least having the ability, we have the vocabulary now that we didn't 20 years ago to acknowledge that it's part of us.
Great. Well, Maggie, thank you for that. And, I want to just in wrapping up, thank all of our panelists today, Maggie, Brad, Jeannie, and Elijah for joining us and for sharing with you guys personally, what you're experiencing and what's working for you in all of this. And, as I was taking some notes and listening to what you guys said, I think the starting point, and I think that Brad probably said it best, is this is all really fucking hard right now, right? And starting with acknowledging that. is just a really good place to start, right? And then I think building on that is all of us creating time to take care of ourselves in it, because we need that space. And you know, maybe it is, you know, one of the resources we had, maybe the answer is therapy, or maybe because you're so busy with a bunch of other things that it's taking, you know, the 5 minutes to pet your dog, or the thing you might not do. I personally will share, I've eaten more Ben & Jerry's in the past 4 weeks than I think I've probably eaten in the past 52 weeks, right? And God, their flavors are incredible. But I think the other thing that I heard from everyone here too, that I just want to echo, and I think is really powerful, is I heard a message of hope from Elijah, right? I heard a message of neighboring from Maggie. I heard Brad talk about us all being allies in this, right? And I think that this is really a time for us to embrace those things, to not only take care of ourselves, but to also ask how we can take care of each other in this moment, right? And so I'd encourage you guys all to take those messages and those lessons from the panelists, you know, home and into your communities today. And also please come to Energize Colorado and check out the resources we have, because we've brought together a lot of things that can help you do those in small increments, or get free access to therapy as well, if that's something that would help you through this. So thank you to everyone for this. And, you know, please check in with us next week. We're going to be doing a Wellness Wednesday every week at 11 a.m. with a different topic and a different set of folks for this. So thank you for everyone. I hope everyone has a great rest of your day.
Thanks, Chris.
Thank you, guys.
Thanks.